Good morning, ma'am. My name is Parvez Siddiqui. My topic local anesthetics, presented by Parvez Siddiqui. Local anesthetics are agents which produce reversible block of nerve conduction without any structural damage to the neuron concerned and without any loss of consciousness. Local anesthetics are used to block all sensation in the part supplied by the nerve. Most local anesthetics agents consist of a lipophilic group, example an aromatic ring connected by an intermediate chain via an ester or amide to an unionisable group, example a tertiary amine. Classification: ester type cocaine, tetracaine, procaine, benzocaine, etc. Amide type lidocaine, bupivacaine, prilocaine, dibucaine, etc. Mechanism of action. Point number 1. Sensory information passes along nerve fibers via electrical impulse or action potential. Point number 2. When nerve is at rest, the interior has a negative charge. Point number 3. An action potential is generated by the influx of sodium ions into the interior of the nerve, giving it a positive charge depolarization. Point number 4. The nerve fiber is returned to its resting potential by efflux of potassium ions repolarization. The nerve fiber is returned to its resting potential by efflux of a potassium ions repolarization. Point number 5. The action potential is then generated along the axon by successive depolarization and repolarization of adjacent region. Point number 6. The primary mechanism of action of local anesthetics is blockade of voltage-gated sodium channels. Point number 7. Bind to receptors near the intracellular end of the voltage-gated sodium channels. Point number 8. This reduces the permeability of cell membrane to sodium ions, so action potential is not generated. Uses. Point number 1. Foreign body removal. Point number 2. A drop of local anesthetics will make location and removal of the offending object very much easier. Point number 3. Tonometry. Tonometry subtype of one. Topical anesthesia is essential for the assessment of IOP. Point number 4. Connect lens fitting. Eye impressions for the contractions of scleral lenses. Point number 2. Certain diagnostics producers. Local anesthetics are used before a Schirmer test of lacrimal functions, metabolism and excretion. Point number 1. The local anesthetics are converted in the liver, amide type, or in plasma ester type to more water-soluble metabolites and then excreted in the urine. Point number 2. Ester type local anesthetics is metabolized by pseudocholine esterase and amide type by hepatic microsomal enzymes and enzymes amidase. Difference between local anesthetics and general anesthetics. General anesthetics are drugs induced loss of consciousness during which patients are not arousable even by painful stimulation. The ability to independently maintain ventilatory functions is often impaired. Patients often require assistance in maintaining a patent airway. Local anesthesia, the elimination of sensation, especially pain in one part of the body by the topical application of regional injection of a drugs. Local and जनरल एनेस्थेटिक्स में मेजर डिफरेंस ये होता है कि ये जनरल एनेस्थेटिक्स मेजर